This is Kashijarya. It is a remote village in the Bokaro district of the state of Jharkhand in northeastern India. Almost all the people who live here depend on farming for their livelihood. They struggle to make a living because the area is very dry and they cannot afford modern agricultural technology. They live their lives in poverty. Some of them go to bed hungry. Small boys play with their homemade toys. Their parents cannot imagine buying toys for them from the market when they cannot even buy enough food for the whole family to eat. Even in this sad situation, they still smile and seem happy. This is not the only village in such a condition. There are so many like this in the area. Some people here make household items by themselves for their own use or for selling at the market. Men also work performing labor to earn enough money to support their family. Those villagers who can afford it keep some domestic animals for selling at the market or for their own use, such as a cow for milk and a buffalo for plowing the land. Nutritious moringa leaves grow everywhere in this area. They provide a staple food for the many villagers who cannot afford enough vegetables from the market. Almost all women are housewives. They primarily do housework. As they cannot afford coal or fuels for cooking, they dry cow dung and gather wood for burning. There is no running water, so people use water from a hand pump, a well, or a village pond. The water is often dirty and the source of many diseases. Some women use pond water for washing their kitchen utensils. Since they do not know about even very basic hygiene, people also use the surrounding area of the pond as a toilet and then use the same pond water to wash themselves. When they get sick and cannot afford to go to the city to get treatment, they go to a nearby clinic. Here they can get treatment free of cost. Abha Seva Sadan is a charitable clinic and community development project which provides the villagers with free medical care in integrative as well as conventional Western medicine. It also focuses on educating the population, especially about nutrition and hygiene. The clinic is surrounded by many trees. There is a playground outside, especially designed as part of a treatment and rehabilitation center for disabled children. People sometimes come from far away to get treatment. Patients wait outside in the waiting area. They stand in a line to register for their consultation and treatment. Dr. Dilip Raut is a senior acupuncturist who takes the patient's cases and prescribes their acupuncture treatment. Acupuncture is very effective in curing many diseases, especially all kinds of joint and pain disorders like arthritis and rheumatism, as well as most neurological disorders such as paralysis and cerebral palsy. Besides the commonly known needling treatment, also other methods of traditional Chinese medicine are applied, such as cupping therapy, which uses suction cups to stimulate a larger area of the body. Abha Seva Sadan also has a physiotherapy section. Almost all patients can benefit from various physiotherapy treatments, such as using the shoulder wheel or receiving hip traction. These treatments help to complement and improve the effectiveness of the acupuncture treatment. Some patients, rather than going for acupuncture treatment, are referred to the homeopathy department. Dr. Prabhas is the resident homeopathic doctor. He has been working with Abha Seva Sadan since 2006 and comes 5 days a week.
তোমার নাম কি বলো
Homeopathy is especially effective in treating respiratory, gastrointestinal, skin, and ENT diseases, and many chronic conditions. Dr. Das is a reputed general physician from nearby Bokaro city. Since the project began in 2005, he has been coming to the clinic on a nearly weekly basis and offering his free services as an allopathic doctor.
Sujit Kumar Das. I have been working with Abha Seva Sadan since the beginning of the project, and I feel that I am giving something back to the society, because here we come across people, patients which are very poor and who cannot afford to go to the city and get their treatment done. So I feel this place is exclusively meant for people who cannot afford simple blood tests and doctor's fees. So we in Abha Seva Sadan try to treat such people who are very poor.
Dr. Lamba is a dentist from Bokaro. Once a week, she takes some time from her busy schedule to come to Abha Seva Sadan and give free service to the villagers. Apart from her dental consultations and treatments, she also gives dental hygiene awareness programs at the clinic as well as in surrounding villages. Dr. Gupta is a senior gynecologist. She also comes every week to Abha Seva Sadan. She provides gynecological consultations and treatments, as well as health education for village women and girls.
And I conduct free checkups for all women there, with special emphasis on the maternity. I take special care of pregnant women there. And not only we are doing free checkups, we try to distribute some free medicines also. We teach them some exercises also for their health, and a special kind of exercise called Kaushiki is taught to them weekly. We also conduct health awareness camps where we teach them various aspects of health to all the women, starting from the adolescent right up to the old age. Teaching them personal hygiene, hygiene about water, and community hygiene. We teach them hand washing is important, how to keep cleanliness, personal as well as in their surroundings, and I think people are getting benefited through that.
Abha Seva Sadan has a special weekly program for disabled children. There are many children in the area who suffer from cerebral palsy, which leads to various kinds of physical or mental disabilities. The widespread chronic malnutrition, which affects almost all the rural population here, is also a major factor contributing towards the many cases of cerebral palsy in this region. Dr. Dilip Raut treats many of these children successfully with acupuncture, physiotherapy, and other specialized techniques for cerebral palsy patients. He is an experienced doctor and has seen more than 1,000 cases. Through his treatments, he has helped many children to walk for the first time, giving them new hope in their life.
जोरे जोरे बोलो जोरे जोरे बोलो अच्छा तुम्हारा नाम की
This girl could hardly speak due to cerebral palsy. After several treatment sessions, she could speak much better. Her condition continues to improve. The acupuncture needles stimulate the brain and nervous system of the disabled children so that their underdeveloped physical, mental, and sensory capacity can gradually be brought up to the normal standard. Other acupuncturists assist Dr. Raut in his treatments. All the staff at Abha Seva Sadan have a very caring nature, and they apply the needles and other treatments skillfully for the patients. Moxibustion is another technique used in traditional Chinese medicine. The burning of compressed herb ashes close to the patient's body helps to deepen the effect of the needles. After acupuncture and indoor physiotherapy is given to the children, they are led outside for further exercises in an open hall. Here, with the help of the parents, the staff use balls, toys, walking aids, and other equipment to further stimulate the children who cannot stand, walk, or move normally. The playground is designed according to the capacity of the children and helps to develop their motor and sensory integration in a playful way. Children must first learn to sit on their own and then to crawl before they are ready to stand and walk. The children are also put into pairs or small groups so they can interact and enjoy playing with each other. Shubham, who cannot yet walk properly, enjoys crawling through this tunnel. This will strengthen his body for learning to stand and walk. On this day of the special Cerebral Palsy Rehabilitation Program, the children are also provided a nutritious lunch, as many of them come from far away. The meal is cooked with more vegetables than they normally eat at home. The patients are treated in a home-like environment. For the first time, at the end of 2015, Abha Seva Sadan has started to admit inpatients. More and more people began to come from far away to receive the specialized treatments offered by the clinic and were requesting overnight accommodations. The daily, more intensive treatment of these inpatients is helping to improve their conditions even more quickly. Some of the children suffering from cerebral palsy have shown impressive progress after receiving daily rather than only weekly treatments. Other charitable service programs organized by the team at Abha Seva Sadan include setting up and providing guidance and support for village women's self-help groups, adult literacy education programs, tailor training for girls and women, eye testing camps, mobile medical camps, children's programs, and, in the winter, blanket distribution programs. Many of these programs are conducted with the help and cooperation of other local NGOs such as the Bokaro Rotary Club. The clinic has a large medicinal and nutritional herbs garden. All the staff, including the doctors of the clinic, help to take care of and maintain this garden, which serves to further educate the patients and villagers. Every day, the staff introduces a few of these commonly available herbs and medicinal plants to some patients. Here Dr. Raut is explaining to the patients which of these plants they can use as medicine for their conditions, or as nutritional supplements for their daily diet.
আচ্ছা এগুলা রাস্তার ধারে এমনিতে উঠে থাকে লোক বুঝে না ভাবে এগুলা ঝুনঝুনি ঝুনঝুনি মানে কি তুমি যেটা লাগাও যেটা খাবে ওইটাই ভালো তুমি আলু যদি চিনতে না আলু এমনি জঙ্গলে হতো চিনলে বলে আনে লাগাচ্ছ ওটা খট্টা পালা জন্ডিস খতম হয় 4 দিন খাও জঙ্গলে হয় কাজে এই জোড়ের হাড়ের এটা দেখো ডিসেন্ট্রি হচ্ছে না এই যে ডিসেন্ট্রি মানে কি জানো
Abha Seva Sadan also arranges other regular awareness programs in the surrounding villages. On the occasion of the yearly World Environment Day, Dr. Raut gives a short speech about what World Environment Day is and why environmental care and preservation is important in our life and for our health.
पानी, भोजन ये सब विषाक्त हो गया है, हवा विषाक्त हो गया है, तो हम लोग को इसको सुधारना पड़ेगा। यही कारण है लोगों को, हम लोग को जागरूक करना होगा इसके बारे में। पेड़ काट दे रहा है सब। देखिए यहाँ जब हम लोग शुरू किए थे हॉस्पिटल, यहाँ जंगल था, अभी देखिए आधा से ज़्यादा पेड़ कट गया है। लोग सोच रहे हैं हम एक ठो पेड़ काट लिए तो क्या हो गया, लेकिन लगाया कठो, समझ पा रहे कि नहीं। आज झारखंड में पानी नहीं होगा तो कुछ नहीं होगा, आपको फसल नहीं होगा। यही कारण है हम लोगों को समझना पड़ेगा। हम काट दिए एक पेड़ तो ऐसा हजारों लोग अगर सोचेगा तो कट गया हजारों पेड़ और एगो नहीं लगा। तो झारखंड एक समय में बहुत बड़ा जंगल एरिया था, आजकल देख रहे हैं जंगल खत्म हो रहा है। यही कारण है गर्मी बढ़ जा रहा है, फसल नहीं हो रहा है, कुआं सूख जा रहा है, तालाब सूख जा रहा है, बीमारी बढ़ जा रहा है। तो इसको समझ के हम लोग सुधार का काम करेंगे। कैसे, जैसे आपका घर में कुछ पेड़ लगाइए, उसमें जो पेड़ लगाइए।
The staff of the clinic go out to nearby Kashijarya village to make the village people aware about the importance of cleanliness and hygiene in their environment. They clean the area at the roadside where the village people are littering instead of throwing the trash into a garbage can. This same cleaning and awareness program is also done in other villages of the area.
ঘরের সামনে দেখতে দেখতে এগুলা কি দেখতে না, কত মাছি দেখতে ভিন্ন ভিন্ন। এগুলা তুমি যখন খাবে তো এই মাছিগুলা গিয়ে তোমার খাওয়াতে বসবে, কালকে তুমি বিমার হবে।
বর্ষাতে সময় বেশি খতরা হয়। বর্ষার সময়
তোমার ঘরের পিছনে কি জায়গা নেই? एक काम करो, এটা ড্রাম কিনে নাও, খাঁচি কিনে নাও, খাঁচিতে রাখবে।
During one of the regular water hygiene programs in the surrounding villages, Dr. Raut explains to a man how to keep the well water clean and how to kill the bacteria by using bleaching powder, that is chlorine powder, so the villagers can protect themselves from waterborne diseases.
নিজের কোয়াটাও সাফ রাখবে, তারপরে গ্রামের লোকদেরকে বুঝাবে। ঠিক ঠিক। তাহলে কি হবে, এই যে ডায়রিয়া, ডিসেন্ট্রি, জ্বর, বুখার হচ্ছে এগুলো হবে না। তো এটা বহুত জরুরি, আপনারা একটু জানুন। আমরা গায়ে গায়ে বলছি। তো এই দেখছেন না, এখানে এই যে আছে এটা ব্লিচিং পাউডারের জল।
Abha Seva Sadan holds a special awareness program once a week by screening one of several educational dramas. These plays deal with the villagers' main problems of malnutrition, poor water hygiene, and the lack of pre- and postnatal care for pregnant women. The dramas are mixed with lots of humor, so that the people can enjoy an entertaining program as well as learn from it. The dramas are performed by local actors in the region's dialect.
गंदगी के वजह से तो यहाँ तर मच्छर पैदा होतीन, जीवाणु, विषाणु और कीटाणु पैदा होता है। तो बता भला एकर में आदमी बीमार नहीं पड़े तो किस स्वस्थ रहता है? कहूँ तेरी हरिया के मदद कर दी और नेपाल भाई कहूँ तेरी मदद कर दी यार, बढ़िया से एकदम पूरा ब्लीचिंग पाउडर फिनाइल का घोरी के और पूरा छिड़काव कर दी। दी साइड इधर के दी इधर देख अपना गंदगी देखा इधर ठीक है भई गेले। हाँ भई गेले, लेकिन ये हमें के रेपरेडी काम खत्म नहीं हुआ है। आज ये काम के हमें के हर एक गांव में करे के आज
हम लोग निःशुल्क इलाज करते हैं लोगों को। पहले यहाँ एक रजिस्ट्रेशन पद्धति के द्वारा देखा जाता है कि किसको कौन डॉक्टर के पास व कौन सा चिकित्सा पद्धति में जाना चाहिए, और हम लोग कोशिश करते हैं अगर उसी पद्धति में उसका इलाज हो गया और उनको ठीक हो गया तो उनको और फिर दूसरा पद्धति में नहीं भेजा जाता है। अगर नहीं हुआ तो फिर दूसरा पद्धति के लिए उनको रेफ़र किया जाता है। यही आभा सेवा सदन का उद्देश्य है कि इसका आसपास के जो ग्रामीण जनता है तो उन लोग कैसे स्वास्थ्यवान हो सकता है, और ज़्यादा दवाई दे के उनको स्वस्थ रखना हम लोग का उद्देश्य नहीं है। वो लोग पूर्णांग स्वास्थ्य नेचुरल उपाय में अल्टरनेटिव मेडिसिन व्यवहार करके कैसे हो पाएगा जिसमें साइड इफ़ेक्ट कम है, उसका भी प्रयास किया जा रहा है। लोगों को उसका बारे में भी एजुकेशन दिया जा रहा है। हमारे आभा सेवा सदन के जितने स्टाफ है, मेडिकल स्टाफ है, सब एक मेडिकल टीम भावना में युक्त होकर ये इलाज करते हैं। और एक टीम भावना लेके जब किया जाता है काम बहुत अच्छा लगता है काम करने में भी। उसका साथ साथ पेशेंट लोगों को भी फ़ायदा होता है, वो लोग को भी अच्छा महसूस करता है और एक फैमिली एनवायरनमेंट रहता है। लोगों को अच्छी तरह से देखभाल किया जाता है, बच्चा लोगों को खास कर जो विकलांग बच्चे हैं।
These are some of the main activities of Abha Seva Sadan. Visitors and volunteers are always welcome to come and see up close how the people here live and how they struggle to maintain themselves and their families. Abha Seva Sadan is in a green and quiet surrounding in this otherwise very dry region. The clinic has several guest rooms, so visitors and volunteers can also enjoy a quiet and relaxing holiday here.